Hi, good afternoon. Thank you very much for coming to join me today. I'd like to talk a little bit about multiple sclerosis. I was talking with a friend of mine a few months ago, and she told me, starting revelation, I have MS, and I've had it for a number of years. And it absolutely shocked me because she didn't have any symptoms that I could see. She didn't look like she was sick. And for me, I thought MS was one of those diseases where you couldn't walk, you couldn't do so many things, and so it completely caught me off guard. So I wanted to research it a little bit, and I'd like to share with you what I found today. According to the National Institute of Neurological Disorders and Stroke, the first diagnosed case of multiple sclerosis was actually in 1849, but they went on to say that the first documented case of somebody that they suspected had multiple sclerosis actually dates back to 14th century Holland. So the disease has been around, and we've kind of known about the disease for a very long time. Did you know there are approximately 400,000 people in the United States that are diagnosed with MS? The United States has a population of 300 million people, so we're talking almost 10% of the population has some form of MS. And there are approximately 2.1 million people, according to the National MS Society, that have MS worldwide. Now, the only problem with these numbers is that they're estimated. There are no requirements to report new cases of multiple sclerosis, so the best they can do is estimate. The numbers could be higher than we even know about. These are the ones that we know for sure have been diagnosed. With the exception of trauma, it's the #1 cause of neurologic disability in early to middle adulthood. That's staggering to me. Absolutely staggering to me. I had no idea. So what exactly is multiple sclerosis? Well, multiple sclerosis is an autoimmune disease, which means that your own body is attacking itself. And in this case, it's attacking the central nervous system. The body's immune system attacks what's something called myelin, which is the covering of your nerves, and it's found right here. Encases the nerves in sort of a protective tissue. What it does is it attacks the myelin, and when it does, that leaves scar tissue behind. And the scar tissue can either interrupt or completely stop the signals that are passing through that particular nerve. And in multiple sclerosis, this is happening in multiple parts of the body. So different systems, different issues can happen all at the same time. Even though that sounds really terrible, multiple sclerosis is not actually considered a fatal disease. Most people who are diagnosed with multiple sclerosis continue to lead what they continue normal or near normal life expectancy. The cause of MS is actually unknown, but researchers have identified genetics and environment as two of the factors for multiple sclerosis. Genetics, researchers have already been able to identify that the particular immune cell that attacks the myelin. They've also been able to determine some of the factors that will cause that cell to attack the myelin, and in addition, which receptors on that attacking cell seem to attract that cell to the myelin. And it's hoped that as we learn more information about these factors, we'll be able to find a course of treatment to actually stop the disease. According to WebMD, environment also plays a significant factor. MS is more common in certain parts of the world, particularly Scotland, Scandinavia, Northern Europe. Generally speaking, in the temperate climate zones, the farther away you get from the equator, the more likely you are to find someone diagnosed with MS. And what I also found very interesting is that if you're a young child prior to adolescence, if you move from an area that's considered a higher risk for MS to a region that has a lower risk of MS, your risk changes as well. So that's strong evidence that there's not only genetic factors at play, but also environmental causes that will lower your risk for multiple sclerosis. It does have to happen prior to adolescence, though. By the same token, if you're in a lower risk and you move to a higher risk area, you also incur the higher risk. So I found that quite interesting. Also, I'd like to note that women are twice as likely to be diagnosed with MS, and it is found in all ethnic groups. However, it tends to be more common in Caucasians from Northern Europe. Okay. So let's talk a little bit about some of the common symptoms for MS. Extreme fatigue, and I'm not talking about the normal, man, I feel really tired today. I'm talking about you had an excellent night's sleep, have had an excellent night's sleep for an extended period of time, but you still feel very tired, particularly in the late afternoons. If you've got any numbness or tingling, blurred double vision, dizziness and vertigo, loss of balance and muscle coordination. Those are some of the most common symptoms of MS. Some of the less common symptoms include a headache, hearing loss, seizures, tremors, which is where your body shakes, or respiration and breathing problems. There's actually 4 types of MS. There's relapsing remitting MS, which composes 85% of all cases. Relapsing remitting MS means that there are clearly defined attacks where I have symptoms, I have vision, I have loss of coordination, and then it seems to stop and I seem to get better, and then I have another attack where things get a little worse. Okay? So it's clearly defined attacks of worsening symptoms. Then there's primary progressive MS. That means that my condition slowly deteriorates over time and there is no apparent break. And that represents about 10% of MS cases. I should say this is initial diagnosis of MS. The third type is actually called secondary progressive MS, and you don't see it on the graphic because it's the same thing as primary progressive MS. It's just that most people, or many people that start out with relapsing remitting, their disease evolves into this secondary progressive. So they may start out with breaks and remissions, and then as their disease progresses, they lose the remissions and they just steadily get worse. So they call that one secondary progressive MS. And then the last kind is progressive relapsing MS. It represents about 5% of all cases. It's the rarest form of the disease. And it's characterized by symptoms that steadily worsen, but then in addition to that, there are clearly defined attacks. So I may move along at a particular progression of the disease, and then all of a sudden I have an acute attack where it gets dramatically worse, and then it slowly gets worse, and then I have another attack where it gets dramatically worse, and so it goes. There is no specific test to diagnose for MS. The doctors have to use several things. They have to use your medical history, MRIs, tests like spinal fluid exams, and a neurologic exam. And the hardest part about the whole thing is they have to eliminate everything else before they can say that you have MS. And that becomes the most difficult thing. So sometimes patients go on for years before they're finally diagnosed with MS. It takes that long to eliminate all the possibilities. Generally, they say that you can confirm multiple sclerosis if they have 2 separate episodes of neurological symptoms that occur at least 1 month apart, and that the symptoms indicate that there's injury to more than one part of the central nervous system. And of course, obviously, that they've eliminated everything else. It becomes very difficult for MS. MS can't be cured, but it can be controlled. There's a number of ways. There's about 7 medications on the market right now that can control the progression of the disease and slow it down, and can also help mitigate the symptoms of MS. And they also use symptom management. Symptoms vary widely between patients, so the treatment programs become very highly individualized. They may use medicine, stress management, yoga, relaxation, alternative medicine, or rehabilitation. In the cases where speech loss, slurred speech is involved, then maybe speech therapy is in order. So there are a lot of different things that they can do. For example, my friend is very into alternative medicine. She was using the traditional medicines for a long time and really didn't feel very well, and she switched to alternative medicine and she's doing great. So it's a very highly personal program that you have to follow. Multiple sclerosis is life-changing, to be sure, but it's not necessarily life-threatening. It's not life-ending. If you are careful, if you carefully manage the disease, if you proactively manage the disease, then people who are diagnosed with multiple sclerosis can continue to lead a long and fulfilling life. If, for example, if my friend had never confided in me that she had MS, I would have never known. Research goes on every day through funding, through groups like the National MS Society, with their continued research. Then hopefully one day we will actually be able to find a cure and stop the disease. Thank you very much.